Dr Kenneth Baillie was one of the first people in Britain to be notified about the emergence of a new virus in China.
It was at the very beginning of January 2020 when the World Health Organization were notified of the outbreak.
Kenneth works in intensive care at the Edinburgh Royal Infirmary and also runs a research lab looking into the role genetics play in a patient's response to diseases such as flu and sepsis.
We heard about how the disease was affecting patients in Wuhan, so we had a good idea of how COVID-19 could affect a population and how that would look inside an intensive care unit, and it was of course completely horrifying. So when it started to happen here, we knew what was expected, and sadly we weren't able to prevent it. The disease just spread too quickly.
When it became very clear there was a real and serious threat, Kenny set about mobilising this massive response to research in his field, and that was just incredible.
Kenneth's mission was to find the genes that made certain people with COVID more susceptible to severe respiratory illness, and he embarked on a huge nationwide study of critically ill patients.
Well, I think it's fair to say that my research has never felt more urgent. We obtained samples to help us to study the genes of the patient and the virus and the proteins in the blood to understand the disease.
Kenneth's study, called Genetics of Mortality in Critical Care, or GenOMICC for short, is the largest ever carried out in intensive care in the UK, with 95% of British NHS hospitals and more than 13,000 patients taking part. And remarkably, alongside his groundbreaking research, Kenneth continued to work on the front line.
I was working flat out in intensive care, looking after desperately sick people.
You'd just be getting a few hours sleep every night and working till after I was in bed and up before the rest of us were up.
It sort of felt like we'd been called up to serve.
Kenneth was also part of a small steering group to test possible treatments for COVID-19, and by June 2020 the team had made a breakthrough. Dexamethasone was found to be the first drug to prove effective in treating COVID. It has now saved hundreds of thousands and possibly millions of lives worldwide.
The fact that we've made so much progress already gives me hope that we can turn this into a treatable disease. We can prevent those people from dying.
Ultimately, he's just been doing what he's always wanted to do and really trying to help people and make a difference.
I can think of few individuals who have made a more important personal contribution to the COVID-19 pandemic response and, almost more importantly, the pandemic recovery. Thank you deeply for Scotland and for the world for everything you've done, and I hope you can be very proud today.
Your pioneering work has saved so many lives. You thoroughly deserve this award. Well done, you beauty.
Hello, Kenneth. It's me, Jarvis Cocker. I just wanted to say thanks for everything that you've done for me and everybody. Hopefully won't have to wear one of these too much longer. I take my hat off to you. Well done.